Oh, sweet merciful goo. That's a lot of ketchup coming out of you. The doctor is in. Let's begin. So, for today's session, we're diving into wound care. Yup, some good old-fashioned first aid work. That includes how to determine the severity, treating them effectively, and knowing when to call for help. With that said, first, you need to be able to assess the wound. For minor cuts or scrapes, these usually involve the top layer of skin, like a paper cut or small abrasion. They may sting, but they don't bleed very heavily. Look for clean edges and a shallow depth. For moderate wounds, these are deeper cuts or lacerations. You might see fat or muscle exposed, or notice jaggedy edges. Bleeding is more significant and may not stop on its own. Lastly, there's severe trauma, like complete removal of a limb or finger. These involve heavy bleeding, exposed bone or tissue, and they are an immediate threat to life. Quick action is critical here. Every second counts. Moving on to wound treatment, when it comes to minor cuts or scrapes, you gotta wash your hands. Always clean your hands to prevent infection. You want to then stop the bleeding by applying gentle pressure with a clean cloth or bandage. Elevate the area to reduce blood flow, then you want to clean the wound. Rinse it under cool running water and avoid harsh chemicals like hydrogen peroxide, which can irritate the tissue. And then you want to try and protect the wound by using a thin layer of antibiotic ointment and cover it up with a bandage. For moderate wounds or deep cuts, rinse with sterile saline. This helps remove debris and reduce infection risk. Apply pressure for bleeding, and if the bleeding doesn't stop in 15 minutes, seek medical attention. Also, consider dressing the wound. Use sterile, non-stick gauze, keep the area clean, and monitor for signs of infection, like redness or swelling. Now, when it comes to major injuries like amputation, call emergency services. Immediately call 911. Stop the bleeding, use a clean cloth to apply direct pressure. If bleeding is uncontrollable, apply a tourniquet above the injury and note the time you applied it. And try to prevent shock, so lay the person flat, elevate their legs, and keep them warm with a blanket. Finally, preserve the severed limb. Rinse the part with clean water, wrap it in a damp cloth, seal it in a bag, and place the bag in a container with ice water. Never directly on ice, otherwise you'll cause tissue damage. Last bit of advice I have is knowing when to involve a doctor. Do this when the wound is deeper than ½ an inch, has jaggedy edges, or exposed fat or muscle, and the bleeding doesn't stop after 10 or 15 minutes of pressure. Seek help. Other signs include infection like redness, swelling, warmth, or pus. Lastly, call a doctor if the wound was caused by a dirty object and your tetanus shot isn't up to date. Alright, for small cuts to severe injuries, wound care starts with knowing how to act fast and smart. Remember, clean, protect, and when in doubt, consult a professional. As the gelatinous doctor, I hope this knowledge can save a lot of time and trouble. So if you found this helpful, like it, comment, and subscribe for more tips. Stay safe and healthy. The doctor is out.